No, you're fine. I'll mute mine. There we go.
So Ryan, my share button is grayed out today. So do you need to make me presenter? Thank you. All right, I'm finally getting the hang of this. All right, starting with the provider workflow, we're going to pick up where the MA would have completed everything that you expect them to do for the intake process, and we'll just start right in and kind of work backwards, as Ryan said. So when you log in, I'm going to go ahead and just bring this up because this is my first screen that I'm going to see when I do log in as a provider. I see I have my appointments here. Gina's already waiting for me because patient tracking is letting me know, also letting me know how long she's waiting. I'm going to go ahead and just select Gina, see what's going on with her. So it takes me directly to her chart and to my SOAP note. Over here on the left-hand side, I see an intake note. So this little, what we call an APSO document, allows me to see what has been captured for me so far. I also, if this is an established patient, have an opportunity to look right over here to the previous one, which would absolutely be my last chart note. And let me just close that down for a second. There you have your last chart note so you can see what's going on. So we see that Gina's coming in right here. She is coming back in about her IBS. What I'm going to do is go ahead and use one of my quick notes to expedite the process of interacting with these templates. So I'm going to select the quick note of my choice. I have a quick note for IBS. This can be provider specific or standardized. That's going to pre-populate, maybe even carry forward some information for me. And you can see my note is already generated. Now, anything that I need to modify, maybe I need to go into the abdomen and change some findings here. Maybe, you know, based on her new medication, now there's absent bowel signs. So I quickly updated that. I also have carried forward a diagnosis and a plan. So I see that I wanted to do a BMP and a CBC today. So right up here at the very top, I'm going to select in my search. This is artificial intelligence that remembers my order and pattern. So I have ordered a CBC before and I've ordered a BMP. So I have that handy. Down at the bottom, I attach my diagnosis codes. Top right, place my order. And now that has simply been done for me. If I did need to renew medications, there's a medication button right up here at the very top. And I can go ahead and just select the med or meds and hit the renew button or prescribe new if I needed to and be done with that. Now, as an opportunity here for me to add an additional comment anywhere that I want to add an additional comment or dictate anything, I'm going to go ahead and just put my cursor right here in this field because as we know, Dr. Podesta, we talked to you yesterday and you use a modal and maybe some of the other providers do as well. I have a modal right here, so I'm just going to put a sentence right behind here to show you in this area. The patient states she is doing much better since starting her new medication period. I'll put that on pause so I can use that anywhere I want to. So we got the modal in the mix. Now I can go ahead and finalize my encounter, code the visit, and be done. So as I code my visit, we're just going to go ahead and do our medical decision making as a piece of that puzzle. And then it will suggest a code based on documentation if I did utilize the templates. Once I submit the code, what that does is capture that code for this visit for today, as well as generate any number of documents like a referring letter, my chart note for today, my patient plan, and can automatically associate that with the patient's record as well as with automated document sharing. Up here at the very top, it can read the information to see which PCP or referring providers may need to get a copy of a referring letter. The patient plan can print out at the front desk, or if the patient prefers, can go directly to the portal. So that's it from a perspective of kind of just quickly going through there to let you see some of the unique functionality with the quick saves and things that in the carry forward feature that you can utilize within the template. So Ryan, I'm going to pause there for a moment. Oh, are we all good?
Ryan, Vince, is there anything else that you wanted her to make sure to cover in this first pass through?
There we go.
Ryan, I don't know if you're muted, but I'm in the car. I'm trying to watch. Are you with anybody? Is there any questions there with the provider flow?
We have Dr.
She's on link. Go ahead, Dr. Fusco.
Am I disrupting?
No, go ahead.
I'd like to know, often we'll see a patient, one pharmacy's in the record, and after you see the patient at what a different pharmacy the medicine sent you. How do you change the pharmacy on the fly?
Yeah, I could come in here, and as I prescribe a medication here, see the pharmacy field here. So as I prescribe new and indicate that I want to prescribe a new medication, we'll just select another medication here. See the default pharmacy? I can come right here and I could search for maybe a different CVS, or I can search by phone number. And now I can add a new phone number. I mean, a new pharmacy on the fly.
Will that be permanently in the chart as the new pharmacy? Or will...
Well, let me show you what happens here. Let's say, let me see if it prompted me. It should prompt me to ask me if I want to do that. It did not prompt me there, but let's go ahead and let's accept it. Let's send. Now it's going to prompt me to make this their default pharmacy if I want to.
So if you want to add like a one-off, like an outlier, because they want to go somewhere else that day, you can just update on the fly. But as long as you don't check that box, it won't reset.
It'll keep the original default.
Yeah, exactly. Yeah.
Correct.
Good question. So really, Dr. Fusco, that was like the 3-minute version of what your duty as a provider is going to be, and that's literally it. That was, everything was worked up prior to you coming in, and those will be your duties. So we just wanted to kind of first showcase how simple it is to work through a visit. But obviously that now we're going to kind of revert back and go through the granular detail of how we got to that point. But the SOAP and the finalize are generally the only 2 tabs that the providers or their right hand spend any time on. That make sense?
The right hand first.
So we have Dr. Fusco and his assistant with us in this room. So I was just kind of explaining that, but I think no more questions, Dr. Fusco? Okay. We don't have anything else in this room, Susan.
Okay, well, let me ask Dr. Fusco, since I didn't communicate with him yesterday like I did Dr. Pernesti, but let me ask him his documentation style, because that's where I learned about Emoda yesterday is from, you know, our conversation with Dr. Pernesti. So does Dr. Fusco have some type of a preference for documentation?
Mostly free-form dictation.
Okay, when you say free-form dictation, what exactly does that mean? Within a template or just dictation fields or?
Within a dictation field.
Okay, and is that within Modal as well? Do you have your microphone attached to your computer?
Always.
Okay, so if you use free form, now correct me if I'm wrong, there is a free form, what we call a free form. That's why I wanted to see. Is yours something like this, just a free form?
Typically, it's just like a dictation box, like a blank dictation box, basically kind of like what you have there. The setup of it is a little different, but it is a blank dictation box that we have.
For the history.
Okay, so you could do the same thing here. You don't have to utilize all these, just whatever you want to, and you could still do the M-modal. So if I put a couple sentences in here. The patient is a 34-year-old female patient of Dr. Cook's period. The patient presented to the emergency room last evening with approximately 7 to 8 day history of abdominal pain, which has been persistent period. She was seen 3 to 4 days ago at Baptist ER and underwent evaluation and discharge and had a CT scan at the time and was told it was normal period. Is that kind of what you do?
Most of it do it now, right?
Okay, so you can certainly do something like that. We also have a copy forward feature. So there's a copy forward button. So if you've dictated, let's say they came in initially, you did some type of consultation or that, you know, initial visit, you may have dictated a whole lot more than you would have for a follow-up perhaps. I can come in here and I can copy forward anything that I've previously or even one of the other providers has placed, you know, within a visit. And that way I don't have to redictate it. I can just modify it if I want to. And it's not all or none. If I just wanted to take, let's say, the review of systems, now it's showing me I've selected that. If I did decide I want to do the HPI, I select that, and that's going to be at the bottom. And then I can save that, and look, that put that in my review of systems area.
So I think if you wanted to like compare it to where you're at today, this is exactly your free form, but NextGen breaks it down into certain segments within the chart. So you could get more specific. So when it says physical exam, when it says assessment, when it says plan, you're just getting more granular, right, into where you want that data to go to versus one generalized box that you're telling your story in. You may get in the habit of using only one of them, and that's fine too, but they give you the opportunity to do that. We did have one question in the chat, Susan, and I know that we were trying to just give that high-level, quick, expedited provider workflow about adding the diagnosis code.
Okay. Well, let's talk about that. Let me just go ahead and close this down. So, Dr. Fosco, if you wanted to use something like this, then all you might need to do is have this template up, and then, of course, you could go to your finalized template and code your visit. And you could have that dictation link. These are configurable. I could have it attached to my finalized and assessment and plan. So down at the bottom, I had with my quick note, I had a diagnosis already associated with it, but I certainly can look up a diagnosis and I can copy forward to from a previous diagnosis assessment plan with this little button right here. So we have that option as well. Now, we also use intelligent medical objects, or we have this search capability here to where I can just come in here and search for a diagnosis. Here's your billing history for the patient. You can have your favorites list over here. Are y'all familiar with IMO for searching? Intelligent medical objects?
They're not, Susan.
Okay. Okay, because we use that in our mobile device and we have an opportunity to use it right here. It's just a natural language query. So if I just wanted to put, ab pain, I can be very generic. I can search, however I want to. So I just put ab pain, and now it brought this in here. I can have, again, my favorites list over here. Now, if I need to select something more specific, this is AUC for appropriate use criteria, right? But anything here that I need to select, if there's a plus, it may ask me more questions, or it may just go ahead and add it to today. So it added it with the IBS. When I save and close, you're now going to see that as my second assessment item. Does that look similar to how you add a diagnosis code today?
You're getting a similar call.
Okay. All right. Do y'all ever copy forward a diagnosis assessment plan?
No.
This will allow you to come in here for those.
The ability to carry it forward from the last visit, or do you always need to start? Yeah, they copy forward currently.
Okay, so that's what this screen is. It allows you not to have to take the last one, but you can look and see which one you want to take, because you may have different plans and stuff going on. So I can just select what I want to do and copy it.
This looks like all the features we have now, which is formatted differently.
Absolutely. Yeah. Fundamentally, they're all very similar. Yep.
I have a question when we're done.
Yeah, feel free to ask it now, because Susan, your plan is you're going to kind of like pivot back now to do a full-blown workup, right?
Let me ask you a question that's related.
Oh, go ahead. Yeah.
Probably about a fourth of our day is spent in our document folder, where we receive blood work, biopsy results. We click on that and then perform some action, often forward it to a triage. How do we receive results and act upon them?
Okay. So that's going to be in what we call our provider approval queue. See this little PAQ button up here at the very top where I'm highlighting? That's right here. It'll have everything that you have in it. Labs, we've got, reports here. This is a CT of the abdomen and pelvic report. Now, what you can do with anything in here still needs your attention, right? Down here at the bottom, you can sign off if that's all you need to do and put an electronic signature stamp, date and time and everything, or you can sign off with actions. You can have predefined actions here to save you time. So if you typically say, let the patient know or schedule an appointment for the patient, based on the findings here or something, you can have that pre-set up as your preferences here so that you can just select it and then that sends a task to the appropriate work group.
One thing I commonly do is if it's an important finding, I will dictate a letter to the patient at that moment. How can I do that from this point?
So I could have, now, do you have some kind of standard letter that kind of fills in the blanks from something that you have here, or do you dictate it?
It's mostly dictated free form with some boilerplate paragraphs.
All right. So what you would do, a couple of things you can do. I can dictate right down here in the bottom, and then we can have it set up to add those comments to a note. And then your predefined action would say send letter to patient. And then in the background, we could go ahead and send that to the portal or print that for your staff to handle if there's no portal account. But you put right here. Do what? What was that?
Is it formatted as a formal letter?
It can be. It'll be however you want it to be represented. Remember yesterday when we were looking at some of our documents and you said, well, could we have our logo on it and everything? And so we had a conversation about, yes, you can dress them up any way you want to so it can look like a formal letter. And then it'll just print it from, the logic, the settings that we have in the background with your dictation that you put in your notes area here.
Okay, thank you.
Mm-hmm. And then if you had, same thing, if you had any lab results here or something, again, do I sign off with or without actions? And again, I could go down here and simply sign off very quickly, and it drops me to the next item in my list to take care of. Or I come here and say we need to repeat the lab or, whatever instructions I want to pass along. I will tell you a cool feature that you have here within your PAQ, provider approval queue. Whenever I have an item here highlighted, if you look down at the bottom, you have face sheet type information about this patient. So you don't have to necessarily open up the chart, or if you want to compare additional labs from historical, results, I don't have to close down and lose my place. I have all of this right here in front of me to where I can look at other things without drilling down into their chart unless I need to.
So if I have a biopsy result, I can open up the colonoscopy without leaving that field and read the colonoscopy report.
Well, you mean like if this?
I'm going to put a biopsy back to the benign polyp.
To this report.
I want to see what the colonoscopy actually show. I want to open up the colonoscopy report before I dictate a letter. I can do that all in one. Now I have to close the biopsy report, open up the colonoscopy, close the colonoscopy, open up the biopsy report. And that's all.
So let's pretend like this is a colonoscopy report right here. If you're just going to add comments, you'll do it down here in the very bottom, like we talked about. But you can read this and you can expand it. I have a small little tablet. I don't know what kind of hardware y'all have. But see, I can, expand this and I can read over this. And then I could go ahead and add my comments down here. Now, if I wanted to dictate a whole letter, but I think I'm hearing you say you want to have macros to kind of bring it in and generate it, not dictate a whole letter. Is that correct?
I use macros and I alter it. I customize it.
Okay. Yeah. So the customization part would be down here that you could dictate within Modal. And then the letter part, the format, would be whatever is defined during implementation. So if that's all you're going to do, you can do it from this one window.
Okay, thank you.
Mm-hmm.
Susan, I have a question. So once the physician sees their pathology report, for example, like Dr. Fusco was saying, he sees his report, He signs off on it. He sends a task to our triage department, who then will notify the patient of their results. The pathology gets filed in the record, but how can you show me how it gets filed in the ASC part of the record?
Okay. So if we're in the clinic, right?
Yes.
We can use some automated document sharing on the background to do that, because you're right, that's going to be a separate practice, right? So
Correct.
if I need to share that report, I either have to, up here at the top, I can print, and, I can send it over a lot of different ways. But if we can do some automated document sharing over to the ASC in the background, we wouldn't have to worry about that.
Well, yeah, that we would have to do that, because that was, I think, the intent. One of the big intentions of us doing this was that our ASC records go into the clinic records, and the clinic records come to the ASC.
Yes. So some of that, it's still one database, but those are separate practices for obvious reasons, legal reasons, with the ASC record being separate. But we can still documents, and we can still communicate back and forth with automated document sharing. So the automated document sharing, it's got a lot of settings, a lot of options in the background as to what we're going to share and where we're going to send things, like when I sign off. So when I sign off on this, I want it to go to the ASC. I need something to go to the patient. I need a task to go to my staff, all of the above. So all of those are things that we are going to have to put in place to make that happen. We also can use our NG Share capability, which is our interop, in order to share documents too between these two practices. Even though it's the same enterprise, the records are separate.
Right.
How are you getting those across today? Faxing them?
And scanning them. We get a copy and it gets scanned into the clinic record as well as the ASC record.
Yeah. So Ryan, we would need to look at some interop capabilities, look at the automated document sharing, so that we can deliver the appropriate information and to both sides, so to speak.
Yeah, no, I spoke with Jamie yesterday. I think the underlying point is the capability to do it is there, and we need to work through that if this group so chooses to move to NextGen during their implementation. Identify routing rules, identify which document types are going to be shared across practices, but yes, the capability is there. We need to work together to make sure it's set up exactly how you want. And it's going to eliminate all of that duplication and triplication of efforts when it comes to scanning, sharing, closing, reopening, and all of that good stuff. So yes, the capability's there, and yes, we would work through that during the implementation process.
When you make the transition, how do we capture the old information?
We do data conversions and data migrations. So that's another thing that we would work through with our technical team to say, what do you want to bring over? So maybe it'll be demographics, maybe it'll be scheduling information. Reports, documents, yes. Yep. The only thing that we generally recommend against when it comes to data migrations is financial data, because it's usually just not a clean transition. But from an EHR perspective, whatever it is, and then we kind of scope that out based on what your requests are.
20 years with the colonoscopy.
Yep. Yep. Yeah, so we actually have a team at GBS. They're called Conversion Services, and they do all extracts, imports from System A to System B and System B back to System A. I mean, we work with all of them, right? So we have clients that will be transitioning from Allscripts to NextGen, from eClinicalWorks to NextGen, from Cerner to NextGen, and vice versa, from NextGen leaving, through acquisitions or whatever happens with business organizations. But yes, the conversion services are all going to be completed by our GBS team. But we have to work through what data you actually want to come. Now, I'm always transparent. Conversion services are billable. So we don't want to just bring stuff to bring it because you're going to pay for that. We want to actually see what the value is in bringing it and then identify all of those individual elements. Does that make sense? Yeah. Thanks, Susan. I don't think we have any other questions at the moment in this room. Anything else from you, Jamie?
Not at the moment. I'm trying to pace myself.
And we are recording again, so I think I'll work with Colleen and make sure that all 3 of the demos are up on the YouTube channel. It's a private YouTube channel, so everyone can just click a link and see the demo, and you guys will be able to share it, review it, dive back in. But yeah, we'll have all 3 demos recorded. And obviously myself, Vince, Ricky, we're all available to you too, if we need to have further discussions. But yeah, you could continue on, Susan. Thank you.
All right. I'm just going to select one of these items down here at the bottom. I'm just for the sake of it. So just pulling something in here. I want you to notice that it drops me down automatically. So as I'm signing off with or without actions, it's looking at all those action items, and it's going ahead. And now this is asking me for comments here on that particular item because it must have been set up that way. Again, if I just need to sign off, again, if somebody has it set up, it's going to ask you, you could dictate in that field as well. So you kind of see where it keeps dropping me down to a click. Totally saves me a click once I hit the sign off with or without action button. All right. So now, for the sake of the providers, I know we're going to start over because, from my understanding, we have some support staff as well. Is that the case with some MAs or somebody?
Yeah, we have a couple nurses that are with us as well.
Okay, I'm going to change gears here for a moment because their little workflow will be a little bit different. But let me ask you this. Before we back up and work a patient up from intake, do we need to visit the mobile application for the providers?
Yeah, probably.
Yeah.
I think it's worthy.
Okay, so we should do it first. Is that what I hear?
Yes, please.
Okay, so let's look at the mobile, and this is a true extension of the NextGen EHR desktop. So you have everything that you have in your desktop in the palm of your hand. So let me go ahead and share. And you should see it come up. Now, I have an iPhone, but it is compatible with any iOS or Android device of your choice. Even, so you may even have larger real estate if you're in the office. But whether you're inside or outside of the 4 walls of the clinic, you have the same functionality. So let's go ahead. I'm going to use a PIN code, but you can use biometrics or something. And that's just telling me that when I was dictating a while ago, I had it in dictation mode for M-Modal. Because remember, I said that I could use my mobile device as my microphone, or you certainly can have, a USB microphone attached to your workstation if that's your preference. But within the mobile application, it has the capability of just hitting that microphone button there and start speaking. So this is our home or our hub screen here. You see it in advanced search at the very top, so I can look for a patient. I have jobs created if I want to dictate. Remember that PAQ we were just looking at? So whatever I had in that PAQ, that provider approval queue to sign off with or without actions, look down at the bottom. Same type of thing. So again, I can look at all my tasks from here. If I have medication refills, I can do those from here. I can prescribe medications if I'm in a patient's record. I can add charges from here. So all of this is available as far as, options of interacting. Now, I'm not going to assume, I'm going to ask, do y'all take call? Anybody on call in the evenings or on weekends?
Yes.
Do y'all do that from an app, or do you have to have a laptop, or pretty much have to stay home?
How does it work, Dr. Fusco?
Uh-huh.
Is Dr. Pernesti there?
Messy low.
Oh boy. Drs. Pernesti and Dr. Lau, are you there?
We're here, we're just, muted.
we
They're
need
probably
your
playing
input.
bubble hockey.
It still says muted. Go click
Oh,
on
we're
it.
still muted?
We're just in between games. It's okay. We're good.
Are we still muted? Can you hear me?
Click on that.
We can hear you.
Oh, you can hear us. Okay.
Oh, what?
There's no bubble hop.
No, we're muted on this, but on the phone we're on.
Oh, okay.
Yeah, we're good.
Oh, man. Watch what you're saying.
So
All right, sorry, what was the question now?
I was just trying to figure out if someone's on call, even if it's your staff, if you have any RNs or anybody that's on call, what is that process? Can you do that from a mobile device? Can you go out and about your business? Do you have to stay home? Is it hard to authenticate yourself back into your network to look up the patient? I mean, do you have to carry a laptop if you leave home? How does that work?
Oh, I use the Allscripts app on my phone pretty easily to look up patient information, old colonoscopy reports, office notes. It's pretty easy to do. You can prescribe medications from the app. It's a little clunky to do medications, but it's doable. It's not easy to review our documents, so our pathology reports and any messages that we get from the nurses. It's doable, but that's very clunky in the app. But most of the time when we're on call, all I'm really looking to do is I just want to see what the last office visit was or what the colonoscopy report was or what pathology results I'm looking for in a patient. And that's easy to do on our EMR when we're on call from the phone app.
Okay, perfect. All right, well, remember, everything you have and would have in the NextGen desktop, you have in your app. So you're not limited and you can interact with it. But I could look up a patient if I got a message to call a patient back. Let's just go back to Gina here. And there she is. Now, like you said, I might want to look at something before I call her just to see what's going on. I have face sheet type information. You can see over here on the left-hand side. I can see even the last HPI here without looking at the last chart note. But if I want the chart note, there's a document images tab over here. I can quickly go look up that last chart note, see what was going on with her, just quickly run through that. If I had a colonoscopy report, doesn't look like I have one on her, but it would be here too. All documents, all images. So after I review this information, I'll probably just go ahead and tell the system to, call her back at the number we were given. It can mask my cell number if that's where I'm calling from or whatever number. But once I call her then and have my conversation, I can add a quick little phone note if I want to, because I have a little microphone down at the very bottom. That allows me to create, a little note of my choice. And these notes are totally configurable, but this one, let me just grab my phone note. This is configurable by provider. If I just want to quickly put in, what this phone call was about tonight, I can do so. And I'm going to put a couple sentences because ultimately I want to show you where that shows up in the record, and it is real time. Gina called the answering service this evening requesting a callback period. The patient indicated she was experiencing some lightheadedness and a few palpitations, and she feels this may be due to the new medication she was started on. Period. I reassured her that this is most likely a side effect from the medication. However, I told her I'd like to see her in the office first thing in the morning. Period. Advised her to visit the ER at any time she felt uncomfortable with how she was feeling. Period. Patient verbalized understanding. Period. All right. Now, obviously, I can correct anything I want to correct or clear it out and start over, but I can send that, and that is already in the EHR. Now, how do I tell my staff that I told her to come in? There's a little green button at the very bottom for messaging. I'm already in Gina's record, so I don't have to, I'm just going to look up who I'm going to send it to, and it can be a work group. And just tell them that I told Gina to come in. You see Gina's name at the very top, so I don't have to identify her. Please work Gina into my schedule in the morning as she was advised to come in for an appointment. Period. Thank you. Done. Now,
so I think one of the good things for you to know or realize, Dr. Lau, this is formally Entrada, right? So NextGen acquired Entrada, which was a mobile corporation for many decades. Now that it's fully integrated, you're in essence looking at a mini version of NextGen on your phone. So what was clunky with your documents, your images, and all of that stuff with Allscripts Mobile, you're going to a superior solution with NextGen Mobile that has full functionality to real-time update folks. So I think she's given a pretty good idea or painted a good picture of how that functions there for you. Is there anything else that was clunky in your mobile currently?
No, I mean, certainly leaving a phone note looks a lot easier on here than it is on our current app. It's doable to leave a phone note, but it is not easy. I very rarely do it because it's such a pain to leave a phone note on the app. But that looks similar. I mean, a lot simpler. I don't think there's anything else that's very clunky on our current app. This looks good though.
Good
You
stuff.
even got your labs down here. I mean, you literally have everything that you have in her record on the EHR. There's nothing missing. Now you also, in addition to that, look down at the bottom, you have your schedule, of course, and there's a calendar on the top right, so you could look at your schedule. You know, if you were out of the office, you might want to look at your schedule for the next day. If you're running late in the morning, getting to the clinic, you may want to look and see what's going on. And right now I can see Gina and Thomas have been checked in because they have a little green dot beside them. So, you know, we were looking at that in the desktop version, right? When you first logged in, we saw your schedule. This is the same thing. We see that patient tracking saying that, hey, yeah, Gina is here. Now, if anybody wanted to, again, I come in here, I could do the same thing I did when I was in the desktop for today's date. I have an intake note. My staff already worked the patient up, right? So I have an intake note here I could look at if I preferred to do that from mobile. And then if I was a provider who at some point may have decided, hey, I want to try my mobile for something. Maybe I don't want to use my microphone within modal anymore, which I can. There is a microphone down here, just like I did before with the phone note, that allows me to go to kind of that dictation template we just looked at in the desktop. So this is configurable, but it's a chart note. You look at the top, it's just one of, you know, our preferred demo ones, but it has tags, just like those boxes on that template. Do I have to use them all? No, these are just my configurable tabs. So again, it allows me to do the same thing that I did, you know, a while ago, whereas, you know, what do I want to put in here? What I want to use it for? We already did an HPI a little bit, but, you know, if I wanted to do, just to show you how this works. The patient is a 34-year-old female, patient of Dr. Cook's period. The patient presented to the emergency room last evening with approximately 7 to 8 day history of abdominal pain, which has been persistent period. So you already know how to do that. You can have macros. I could say, insert normal, review a systems macro, and then make changes if I wanted to. Or, you know, I could put in a plan. The 34-year-old female with greater than 1 week history of abdominal pain, now more localized to the left lower quadrant period, currently is a non-acute abdomen period. Just keep on going. And then when I send it, it goes into those boxes that we were just looking at. So at some point, a provider may say, you know what? I'll just use my microphone on my mobile app to do the same thing that I'm doing on the desktop. So it's just preferences. The nice thing is NextGen has a documentation style for any provider's preference. And then I could go ahead if I wanted to and say send on the top right. And guess what? That's in the EHR as well. Now, staff could use this too. I mean, they may have an iPad or something with this on it. They could use it to get consent forms signed for procedures or, you know, surgical, whatever y'all need to do, right? I mentioned this yesterday for those that were on the line, but, you know, obviously I can take photos here. It's compliant. They don't store here locally in my photo area, but we also can have, didn't mean to do that. I'm not going to take a picture, but I want to show you my content. I could have for educational purposes, I could bring up something to have a conversation with a patient. I could mark up, you know, an image or something. I can have them sign. We could even have witnesses sign. You know, whose signature am I capturing? Maybe it's the patient's, not the provider's at this time. So we're going to give this and we're going to have Gina sign it. Put something in here, done. I'm going to confirm it and I'm going to place it wherever I want to, save it. I can put it into a category of my choice. So, you know, you'll have your own categories here, probably just a handful. We've got a little bit of everything. This is a consent form, let's just say, for a certain procedure. And I'm going to send that, and that's already in the chart too, not only in a date, but it's also in a category. So a lot of nice pieces of functionality here. If you're doing nothing but just looking at your record, that's the coolest thing, because I have everything. And then maybe at some point I become more comfortable and I work my way up to using some of the additional functionality that we have, like the different dictation options and things like that. You also probably co-manage your patients, with their PCP or other outside providers. I could even, with that same little messaging button that I, sent my staff a message about her coming in, I can, if I have them in my contact list, I could check, let's say Earl was a provider. Doesn't have to be a NextGen user. I could even send something from Gina's chart as well, or I could just come in here and say, I'm going to create a new conversation, and it's going to be with this outside provider. We go back and forth and have our conversation, because they're going to get a message. If they don't have our mobile app, it's free to them. They can download it. We'll have a conversation back and forth, and then let me show you. Let's go back to my message in here. All the messaging conversations that I have an opportunity to say, send it to the EHR as a little document, delete it, or I can leave it here like we have as some examples for as long as I want to. But it will send a little document if you want to have that conversation as a part of their record. So again, it's got a lot of cool functionality. Anything else? Any questions about mobile? Or Ryan, can you think of anything I may have missed?
No, I think that was a pretty good overview of mobile. It's fully integrated, and you're going to have, just because I'm familiar with Allscripts Mobile too, additional features and functionality that you don't have now. Seamless integration. But yeah, no, I think you give a good explanation and showcase some of the tools that they'll be using that are either clunky now or they don't have at all. The ability to execute documents and everything and file them away into charts is a really big value add that we get a lot of good feedback from our current client base. So yeah, I think that was a good run through there. So we had another provider join us. We're going to want to share the demo with him. But what we did was we started today a little differently. We went through a very quick, like 3-minute exercise of what your duties are. We had something already worked up, and then kind of showed you bing, bang, boom, how you finalize it, modify and finalize. And then we kind of jumped over into the mobile to show the full functionality of mobile. Now we're going to go back and do more of the granular, how your nurses and your assistant and your staffs are working folks up until they get to your point. So yeah, I think we're good with everything at the moment. Jamie, anything from your room over there, from your folks?
Yeah, I had one question about mobile. Susan, when you were talking about, doctor talks to a patient and, he generates a note that he wants to share to the chart. Ryan, I guess maybe you can answer this too. When you talked about automated document sharing and routing that appropriately for our workflow, can the doctor, is there a way to route, do we have the ability to route that mobile note into the surgery center note if it's a surgery center related issue?
So I may need your help there, Susan. From an automated perspective, I don't believe that's possible from mobile, but as she just showed, we're going to build out your document types and your category types during implementation. And it's like 2 clicks of the button on the mobile to push it to that area. I don't know if you can automate across the phone interface though.
Oh, Ryan, I have something. Jot this down, if you will, because I have an idea about that. Okay, that phone note goes into the record. Look over here. I came back into the desktop just to show you everything I told you that was going to be here real time is here. My dictation, anything that I, sent over here is here. So even that, here's that consent form. By the way, I can save it at a larger font and size and everything. When this comes in here, Ryan, so here's what I'm thinking. When this comes in here as part of the chart is a phone note, now the automated document sharing can look at this title of phone note, perhaps, and route that to the ASC automatically because it's already in the chart. We just need to get it over there. So it's not really going from mobile per se, it's going from here. So why don't we double check to see if, because this is a document and it's called phone note, can we put that into the automated document sharing to get it over there? What do you think?
So yeah, no, that's a great point. So to answer your question, Jamie, I do not believe that we can automate from the phone. But if from
Okay,
the
that's
phone we
fine.
push it, if from the phone we push it like we just did, we might be able to queue it up now within EHR behind the scenes to then go into that like automated sharing cadence where maybe we wanted to push over to the ASC or push over to the PM. So the automation I don't think is available in mobile. I will confirm that. And then we'll find out if we can kind of put it into that automation cadence once it shows up in EHR. Does that make sense?
And that's even fine. Yeah, that makes total sense. And that's even fine if the automation happens once it's in EHR. I'm fine with that as well, as long as it gets over there. I don't care if it comes from the mobile or the EHR.
Okay, so me and Ricky are making a note on that. That's the first note we have for today. I personally like when I get stumped. That was a great question to see if once it's pushed from mobile to EHR, can we then get it into that automated document routing rules module?
Okay, great. Thank you.
Good question. Thank you.
All right. Another thing I was thinking too that I didn't mention when I was in mobile, I mentioned it, but I didn't show it. We could take photos of something, but that could still be photos of a face sheet. That could be photos of some report. If I was over at the hospital, that could be anything that I can send over here, just by taking a snapshot of it. And it is compliant, as I mentioned, and it's not stored locally in my photo area. So again, if you run across something, I want a copy of that, snap a picture of it, send it to the record. So that is available today. We have providers that if they make hospital rounds, that they actually, if it's a patient that they weren't expecting to see that was not on their rounding list on their phone, they would go ahead and just put in a first name, last name, and take a snapshot of the face sheet, send it over to the billing team, and the billing team finishes out getting the demographic record and of course the charges and everything they need to capture that rounding. Another nice workflow. All right, so let's back up now. We only been talking about what the provider does, how they just hit their SOAP note finalize and can be done from within the desktop version. You've just seen the mobile version, but the same thing applies to the MAs from the perspective of when they log in, this workflow inbox comes up automatically. Now, I have it coming up directly right here to my appointments, right? Because I need to see what's going on. But I also have that same provider approval queue. I have the same clinical tasking. I have patient portal if patients are communicating with you electronically through the portal. And look at here, this patient's been checked out. You see where it says checked out for the status now? Because we've been doing the patient tracking. As an MA, I see that there is a patient that I have staged. I see somebody's checked in that I haven't even gone to pull back yet. But then I have a patient that I've just put with MA to let you see patient tracking. They'll do the same thing as the providers did. They'll select that patient they want to work up. It brings them to their preferred screen, which is an intake screen. Remember, we brought SOAP up a minute ago, but now we're going to take them directly to the intake. And they'll just work from the top to the bottom. Now, I know it varies practice by practice and sometimes provider by provider as to how much or how little your support staff captures for you. If I need to do vitals here, I just hit the add button. Now we do have interfaces. I don't know if y'all take them automatically today. To simulate that, I can click on this button and look, it just populates some information for me. So that's to simulate if I had a device and at that device I hit enter or print, whatever it was, then I could go ahead and upload that as discrete data. Otherwise, I'm going to be putting these in manually, right? So any vitals that you need to take, it does record who took them and the date and time that they took them, and then it populates my grid. Moving down, I'm going to review allergies, or I'm going to add allergies as needed, but ultimately, I've got to review them whether there's any allergies here or not, and there is a review checkbox right over here. Same thing with medications. I'm going to reconcile medications. There's different ways to reconcile medications. But ultimately, we want to say that we, did reconcile. There is an add button here if you need to add, update anything. We can get the, the list of medications from SureScripts so that you can electronically, do a comparison. or bring in. Maybe it's a new patient, you don't have any medications. But maybe it's an established patient, but you want to see if anything's changed that the patient didn't tell you about. You want to do an electronic medication reconciliation. Now, somebody's going to have to tell me this. Do the MAs or support staff do some of the reason for visit, or is that something that the provider does because it's really the HPI? Do they kind of put a few comments in here? The reason I ask is because that panel can be eliminated if you tell me that no, the MAs don't do anything like this.
The MAs do.
Okay, do they capture a lot of information or just put a little sentence in?
We don't really put the sentence, just usually like a diagnosis.
So they're not getting very detailed. Diagnosis at least at minimum.
Chief complaint.
Yeah.
Chief complaint.
Abdominal pain, rectal bleeding.
Yeah. The associated history of patient, the associated HPI, do anything with that or just put in the chief
No,
complaint?
just the chief complaint.
And then let the doc
For that,
tell the story.
Yeah.
Okay. So they're really just kicking it off with the what the patient is presenting with, but they're not getting detailed. They're not doing a lot of the HPI stuff or any for that matter.
Okay. So you can do just quick little intake notes right here, or I can come over here and say abdominal pain. If you want them to take a little, I thought I heard a little bit of information. Somebody's got this. Look what they've got it defaulting to, Ryan. I don't know why they have this here, but they can take as much or as little information as they want. But basically what I would do then, I would just say, don't launch the HPI and have that my standard default. So that basically it puts in this, and then I can just put in a couple sentences if I want to.
So
I think that's what I'm hearing that's going on, just they're not really elaborating. And then going on down here, do they do review systems or is that all the providers? Because again, if there are, we can, save them time by whatever you want them to default to. And then they could come in here if there is something, just click on one of these lines if there's something they need to add. Histories, now, histories will, they're going to carry forward, right? If we have collected them before, and I would do the same thing, I'm just going to hit this little history review button. But if I need to add something, I just hit the add button and it comes up and says, maybe they told you about a new medical condition. They told you they do have GERD. They've had GERD for a while. Now, again, I can be very generic and just simply say they've got GERD, or I can add details. If I just want to add, that they have GERD or a history of GERD, then that just populates the grid. And then the next one is just about orders. Now, in a demo environment, we don't complete a lot of things, and that's why you see we use the same patients over and over. However, in reality, if I was an MA and I was doing some kind of chart prep or chart check, I might want to glance down here to make sure that all of the previous orders have a completed or results received status, because I might need to follow up on something before the provider sees them. So that's it. I'm at the bottom of the screen, but y'all tell me if there's anything else that the MAs or staff would do.
No, they can't think of any outliers.
Okay.
Can I ask a question?
Of course.
Susan, if you scroll back up a little bit and you go to that box above, see where the date is next to the disease or the disorder. Does that date come in automatically whenever it's entered, or does the staff have to enter that themselves?
So this right here was something that was manually entered by information, the information that somebody gave me.
Okay.
If you had a report come in, that would have come in off of order management, depending on if you ordered it or whatever. But if something comes in, especially from the outside, then we need to put some information if we want discrete data into these fields.
Okay.
Now, what's been happening while I've been doing that? Now, I can create an intake note very easily. We have an intake note. But over here on the left-hand side, this dynamic note builder was adding whatever they were adding, whatever they were checking and reviewing or adding. So it created a note. Remember, we looked at that when we went into the SOAP note for the provider. We looked at this over here, as well as we looked at the previous chart note, so we could see, oh, what went on with this patient last time? They had diverticulitis of the large intestine without perforation. So, you know, I've got all the information from my last chart note available, and I have this dynamic note builder. As we're adding things on the SOAP, it's going to continue to add to today's note. Now.
So correct me if I'm wrong, Susan. When I was demoing the software, I always used to tell people, you know, generally speaking, your workup staff is focusing primarily on intake and histories tabs, those two tabs. Providers are focusing on SOAP and finalize, sometimes not even finalize based on what the office workflow is. But just as you mentioned in the ASC world yesterday, a lot of these grid panels are just replicated because we want you to have access to the data so you don't need to bounce back and forth. But when you're thinking about what your duties and responsibilities are, it's very basic. 2 tabs for the workup, 2 tabs for the provider, and then, you know, your front and back office staff, you know, sometimes they'll do checkout duties and requisitions and things of that nature. But do you still agree with that kind of high level assessment, Susan?
I do, except I have better news, Ryan. So I got better news. Most of our clients take away the history tab. This is configurable. They take it away because we now added the panel right here. So now, hey, they only have to stay on the intake, and you're right, we'll take that out. That doesn't even have to be present anymore unless you just want it. And then the providers, the SOAP, and the finalize when they interact.
Awesome.
Yeah,
I know it can tend to be overwhelming when you're seeing the platform for the first time, so I like to kind of dumb it down. There's not a lot of navigation that you need to do from a day-to-day. There's not as much clicking as one would think, because we're going to build the template defaults, we're going to build the quick saves, we're going to build the my phrases, we're going to build the macros, the auto import all kinds of information. That's where you need to realize that the most valuable or the most important phase of all of this is implementation and training. Like, if we don't put the time in on the front end, I've seen the worst and the best. Go lives can be atrocious, or go lives can go very smooth, and it's really as long as we're co-owning the implementation and training phase. The softwares at the end of the day, fundamentally, they're all similar. We're all trying to do the same thing. Allscripts, eClinicalWorks, Cerner, you know, Epic. They all have the same tools now, but we just want to make sure that it's configured and set up in a manner that works for you. Because, you know, I could equate it to Minnesota Gastro, a 300 gastro provider group that we have in Minnesota. Their click by click might be a little different than you because of how they go through their workflow. We just want to understand exactly what your workflow is, so that through that INT process, we're setting it up exactly how you want it. Sorry, Susan, go ahead.
No, that's fine. So, but let me show you one thing. So I just stay on this one template, work from the top to the bottom, enter what is needed. Don't even have to worry about generating a note. I have it right here. And then all I need to do really is come to my little patient tracking and say I'm done. I put them in room 2, and now they are waiting on the provider. And save and close. And now the provider, you know, they're looking at their inbox right there, and they see waiting for provider in room number 2. They select it, they come in here, and a while ago I had the SOAP come up automatically for them. They go directly to their SOAP, and they work through their documentation like we did earlier, finalize, code the visit, and they're done. So again, you know, working from top to bottom in your one template pretty much, because this is where you're doing all your work, you have that same concept. Now that quick save here, it's going to tell me it's already been started. But you have, if you come in here, remember I showed you the option to dictate for those that are using a modal. So you could do that just like you did before. We already have a review of systems. Now, again, I used QuickNote for the whole SOAP last time, but now if I just want to use it for just my physical exam, I could use by default or I could dictate. So again, you know, I've got whatever it is that I have here. I'm just going to select something to show you, but I can predefine it. Again, go in like we did earlier and say, hey, you know, nope, everything's good now. We've got them on medication. They're following up. And then again, I told you we can copy it, you know, copy and paste whatever it is that we want to do. Multiple ones if we had multiples, close it, and now I can adjust it as needed. But we showed you how in any field, just like you're doing today, put that cursor there. If you want to just use this very simple, like we brought up earlier, I think Dr. Fosco does this, right? They like this template, and a lot of providers do because they just, you know, put their cursor wherever and start speaking like you're used to. Or
Can
they
you,
have.
can you do that? Can you do that one more time and show these my phrases again here? Because I do have a new doc in the room with us, and I just want him to see that. Kind of show him the dictation on the fly, the my phrases, and the copy forward real quick, if you don't mind.
I do not mind at all. Let me see if I can get Immodal back up for me. Hold on. The way they have us set up for demo environments a little bit different than what you have. So hold on, and it's telling me it's coming up. That's just so that in our demo world we know. All right, let me put a couple sentences up here with HPI like we did before. And who do we have here? We've got it. We've got not a 34-year-old, we got a 62-year-old, right? All right. The patient is a 62-year-old male patient of Dr. Cook's period. The patient presented to the emergency room last evening with approximately 7 to 8 day history of abdominal pain, which has been persistent period. He was seen 3 to 4 days ago in the Baptist ER and underwent evaluation and discharge and had a CT scan at the time and was told it was normal period. He was given oral antibiotics at Cipro and Flagyl period. He has had no nausea and vomiting period. All right, so that's how I understand some of you do it today. I also want to show you that if you've seen this patient before, you have a copy forward button. So you could come in here and you could see what has, you know, what's been documented before, and it could be different areas, different doctors. And all you have to do is select the portions. It's not an all or none because our providers didn't want it to be, because they might not want everything. They might want just, you know, the plan or the HPI or something. Save it, copy, and now that's in here. We also have my phrases. My phrases is just a sentence builder. Again, I can, you know, go ahead and insert something with those are little macros. So that was 3 different options that I showed you. I used Immodal, direct to desktop. I carried forward to review systems, and also I use the my phrases here, and I can also type if I so choose.
A lot of different modalities, I guess, is the value there. We know that different providers work differently, and we want to give all providers their options. So we do it. You want to talk? You want to type? I got some docs that type like me, 2 fingers. I got some docs that type 1,000 words a minute. You know, whatever you want. We just want to give you all the options. That's the point there. Thank you for reviewing that, Susan.
Absolutely. So whether I use a SOAP note and I like the, you know, the different templates, whether I use this, whether I use mobile, you know, ultimately I just finalize my visit. So I come into my finalized template. If I want the system to suggest a code, now if I dictated, I'm going to have to manually select a code down here. If I did use templates and I have documentation, the system can suggest a code based on documentation into the.
So I think this is very important for the providers on the phone, just because I always get these questions. So you have to use common sense. If you're clicking and you're checking on boxes and you're navigating through the system as the system was designed, you can use the system code calculator. If you're dictating and you're using my phrases, it's not aggregating all of your clicks and all of your documentation. So it's probably going to always spit out a 1-1 or a 1-2 or a, so just know that based on how you go about completing your visit, you can use the calculator if you're click heavy, or you could just choose your own and override it. There's multiple options. And again, we give you those options based on knowing one doc may go route A and the next doc may go route B and the next doc may go route C.
All scripts are the same way.
Same way. Okay, perfect. Good. Sorry, Susan, go ahead.
No, that's good. And then when I submit it, that's in a holding tank, as we mentioned before, for billing, but also generate all of those documents that we talked about. So with the one selection of this button, it's a one-to-many as to what can happen. So it puts, it saves the 992 in the holding tank for billing. It generates our compliant chart note that we may need automatically in the background. It generates a referring type letter that you may want in the background, and also looks to see up here at the top if there's any providers you want to send a copy of that referring letter to. It creates the patient plan for the patient, their summary of today's visit, and either prints that out if that's what they want, or can send it to the portal if that's their preferred method. So again, one-to-many options with one selection of a button in NextGen. And then we talked about medications earlier, being able to change pharmacies. This is a different patient. So, if I prescribe new, I would have my favorites list. I know you have your favorites list too. I'm just going to select something again here, since this is a different patient. It's going to do, DUR checks for us, right? If you have those turned on. Defaults to the pharmacy. This is where we said we could use this little button here to change it for this one prescription if we wanted to, or change it permanently for all moving forward. And then we just accept it and go ahead and send that to the pharmacy. And by the way, we can do multiple medications at the same time. If you have prescribed them 2 or 3 or 4 different medications, I can select all of those at one time and send those at one time, or renew those at one time, even if there's different pharmacies attached to them. All right. Anything else that we can have a conversation around? Or
I have a question.
Uh-huh.
You now do telehealth using a different program, and they're side by side 2 different computers. Is telehealth built into NextGen?
Oh yeah. So if I've had a telehealth appointment, whether I was looking in mobile at my schedule, whether I was looking at my schedule right here, my telehealth visit would be right here, right with it. So now for mobile, remember the green dot in the schedule beside a patient that's been checked in? If you have a virtual visit there, only one place to look at your schedule for clinic as well as virtual visits. If a patient was waiting in that virtual waiting room, it would have been a green camera. You could have clicked on the camera from your mobile device, and it would have taken you to the patient. And then you could come back, and you could, if you were going to dictate, you could, again, dictate right there in mobile and not even use the desktop. Now, if you're going to use the desktop, it's the same documentation, right? It's just how am I going to access the patient? But I can document the very same way. But now, did you have two? You have 2 screens?
All in the one program.
So you could keep, if you do a lot of virtual visits, you could have the virtual visit program up in the background. It's ours, it's integrated, but you still have to have it up if you're going to be using it. And then you could have dual monitors, or you could have it up side by side if your computer, laptop or whatever you're using was large enough that would be okay. It also, when you do billing for that, it can look at the insurance for the encounter that's associated with the encounter. And here's the insurance up here, but they may have multiples to know, which virtual visit code, because we got a visit type, right? We got telehealth, video, or telephone. It looks at the insurance to know what codes, or if any modifiers or anything needs to be added automatically. So the providers or the billers, neither one have to worry about the coding, the way the coding works.
Can you do me a favor, Susan? Depending on what hardware they have, we have some technical folks in here with us too. If you right-click on the MDI tab, can you hide your history bar and then right-click and kind of split the screen so you can show them how on one screen you can also split?
Oh, I can split anything. I can have a report up, or I can just have two different templates up. I can, whatever I want, and I can decide how much.
Some docs love screens this wide, some docs love vertical screens, some docs, like, you have all this ability, if you don't want dual monitors, to split screen, share stuff. Really, again, you're kind of building it however you want it as the doc. Thank you, Susan.
Yeah, I could have up, you know what? I could have up a report over here. I could resize my screens, and then I could look at the report while I'm dictating, if I need to do that, like some of our providers do.
Awesome, thank you.
Mm-hmm.
What else? Not many of my clients utilize the checkout. You just want to kind of just show it. I don't know if that would be a back office function for CDHN or what, but this is kind of like where you could come and review the whole visit.
Let me go to that other patient. I think we had some orders in Gina.
Yeah, that'd be perfect.
Even though she's checked out, let me see what we got for her. Let's see if we got anything here. So this is what, if an MA, let's say an MA needed to come back in the room or something, this is kind of a checkout for staff. They could come here and they could see all the different orders, right? And they could see, you know, labs or referrals or whatever. And if there's anything they need to do, like print requisitions or, you know, just whatever. And they also could indicate that if the patient refused and put a reason why they refused to have a certain test done or something. But this just gives them a place to kind of review everything in one place, because if a provider ordered a bunch of different things on a patient, and they, you know, staff is supposed to come back into the room after the provider leaves, because that's some people's workflow, then this is one place they could come to see everything together and document whether they took care of it. It's kind of a checklist for them if there was something they were supposed to do, or if the patient refused to have it.
So kind of just like that one-stop shop. If something didn't happen automatically, you know, you can manually do recs from there and all that good stuff.
Could we see a screen with triage would see? Triage comes to work and they turn their computer on.
Yeah, that's what I was kind of wondering. So like if it's not like an office patient, so say, you know, whenever we looked at the doctor's documents before, whenever currently what happens is they comment on it and then they send it to me, and then I typically relay that information along to the patient by calling them, and then if they order like additional tests or, you know, medications or anything, like I send that stuff in.
So Susan, how does the technician see a task or a note that a doctor originates within the PAQ is what they're asking.
Okay, so anything, there's some automation with that. So if I'm going through, if I'm on my SOAP note and I go through and I order this, that, and the other, and it requires staff to be involved, surgery scheduling or whatever, in my inbox, you know, everybody, when we log in, we all have an inbox, right? Because we may have tasking and things like that. I will have my own task list, or I have a work group that has it. So this is not necessarily for just providers. I'll have my own. So if I'm a surgical coordinator, I'll see that surgeries will request, you know, whatever it is that I have here, there's some outbound referral requests that, you know, maybe we need to do something. It will be in the tasking area here. These categories are configurable by user. So, you know, depending on, you know, the triage, if you're going to call it triage, maybe all the triage personnel they share this, maybe that's the way it works there. And you'll have your own category so that when a provider has ordered something, it automatically populates in here. Or when they review something in the PAQ with actions, it appears here, but it can go to a specific category if you want it to, not just one big long list. Is that what you were looking for?
Yeah, and then can you just show them, there's some chatter going on about like, people are on vacation. Can you just briefly show them how you set up like a delegate and give vacation access or permanent access?
Cross coverage.
Yeah,
Because
cross coverage.
Because whenever the doctors aren't here too, is I have access to all of their inboxes, so that way I can see. I can see it all.
Is anybody familiar with Outlook where you can go in and say you're going to be out of the office?
Yep.
Yeah.
It's kind of like that, but look at this. If I have security, you have to have security to come. Now, I could say Dr. Barclay is going to be out of the office. I can schedule it ahead of time if I want to. So I could put, I know I'm going on vacation in 2 weeks. Then I can have provider or users as my delegates, and I would transfer them over here. It could just be one person. It could be a work group, right? And then I can, if I need to, I can assign them all the different items that I would have, or I can pick and choose and say, well, my staff's going to get these types of items. That's what's up here, documents, images, labs and stuff. Or I can split it or have it all to one. You may want providers to get some labs, especially the labs that might have abnormal values. Maybe the staff can get the ones that are in normal range. So this is kind of where you set up the logic. Maybe you don't want Wendy to get certain types of items, so you're going to split up. You're going to split up who gets what.
So yeah, it's real cool to be able to handle while people are out and delegate and give people access. So
especially with like abnormals, if it's already like automatically sent to like the backup provider.
Yep.
So we don't have to worry about that.
Yeah. No, that's great. Thank you for being flexible too, Susan, because I'm hearing some talk and it's just valuable to show that it's all there.
Oh, absolutely. We want to get all the questions we can answered.
So for the sake of everyone's time, we are coming up on like 5 minutes. It's crazy that was already minutes out. Are there any specific questions? Like I said, we're going to get you all free recordings. We're more than happy to do additional demos. Vince, Ricky, myself, we're all available to call in anytime. But are there any questions specifically around EHR and or the last couple of days that we've spent going through some of this stuff? I mean, like I said, fundamentally, all the platforms are very similar. There is going to be a learning curve, but in my opinion, the most important thing is if you choose to go this route, you spend valuable time together during INT, during implementation and training.
I have questions.
There's nothing in our room. Jamie, anything over your way?
Yes. So my first, yeah, I know. I don't want to, dominate here, but I do have some questions. So my first question is, obviously I know we can build documents within EHR, but would it be a separate tab, or how does that go? Like right now we have our infusions that are documented in the record. In Allscripts, we've built a flow sheet and an infusion record. Would it be the same kind of concept with NextGen?
Yeah, so if you have, is it an infusion template that then creates a document, or is it just a template?
Well, I guess, Jen, I don't know, you'd have to answer that. Is it a template or is it a document you build?
Actually, it's a form that was created. It's an output document. I mean, it's none of really of what you've talked about. It's actually a form that was created.
But isn't that form because there wasn't the capability to do it any other way in Allscripts?
Pretty much. I mean, it's a form that they use that we created the form in Allscripts, and it's an editable form. It's just.
So what all is on that form? I'm looking in a different specialty because we have an infusion template in one of our specialties that can be shared across to any specialty.
Well, I'm sure you can probably answer it better than I can, but I mean, it's patient name, ordering physician, date of birth, height, weight, med.
Yeah, a lot of what. Yeah.
What about
I mean,
this?
a lot of what's on that infusion flow sheet is very similar. We just need vital, like multiple vital signs would be maybe added
Down
to
here?
this.
Down here?
Yeah. Yeah. No, this could potentially be used. And could this infusion flow sheet be customized so we have one for each type of drug that we infuse?
Like defaults based on a drug or just different information? So,
Yeah.
yeah, it could be. You can could create some of those quick save types, but look down here. We also have an infusion versus a medication. If I select that, it changes. Some things change here. Infusion, medication, or medication. So some of the fields change so that when I say infusion, medication, and then I say this, so that when I click on that, there's behavior that's different. So absolutely you can, but you've also got interview questions over here. And I don't know if you need this disability, but we got the index over here for disability. But what you could do is just like what I did was I went to our rheumatology. You get all this if you need it or not. So that infusion link could be added right to y'all's in gastro so that you have benefit of the fact that it exists.
And once the infusion nurse finishes up that, obviously that document then can just be shared to the physician that's signing off on that.
It can document, or just a task when they finish could be sent to the provider to unless they just want to see a document.
Right. Okay.
Funnel to PAQ because it requires sign off, or we can send them a task. There's multiple options.
Absolutely.
So great question, Jamie. I think the high level thing for you all to understand is templates out of the box. We can also build custom from scratch. Documents out of the box, we can also build them from scratch. So, if there's not something there today, we would just need to know what you needed, and it's possible. With this particular question that you asked first, Jamie, it's already in the KVM. So all we need to do is get access to it under another subspecialty.
Right. Okay.
That's a good question. I'm glad you asked that, Jamie, because now you know that we have this, even though it can be modified. What other questions? I think you had more than one.
I just have one more, and this is just kind of like a general question regarding having EHR. It's always a question on our mind. If computer systems go down, how do we document? Do you have a paper version of this record that can get scanned in, whether it be the clinic side or the surgery center side?
Ryan, do y'all have recommendations that y'all share, have a conversation with your clients about that?
You, Ryan. I don't know if Vince is still on, but I'd love for Vince to just say there's no chance they go down, but I know that's not an acceptable answer. All of my clients have different, methodologies when it comes to what plan B is. I don't think there's any standard, this is what we're going to do. I need to do some more digging on that.
Well, I guess my question, Ryan, would be right now in probation, if our record goes down, we have printed out paper copies, blank paper copies of the chart, and we just chart it and then we scan it in. So I guess, the question is can we get a blank template of a record, whether it be, again, the clinic or the ASC, that the staff can just fill in and utilize as their documentation, and then it gets scanned in, at the end of the case, because that's what we had to do because maybe the system was down or whatnot.
Is Ashley still on? Oh no, Ashley had to jump. Ricky and I are going to make note of that. That's a great question, Jamie. I don't have an answer that I'm confident about.
Okay, that's fine.
Vince is on, though. I could try to help fill some gaps if you'd like.
Yes, please.
So there's multiple things that we can do. And NextGen formerly, I don't know if they still have it. They did actually have a fully offline application that you could use that when you come back, Then when your system comes back online, it'll sync.
Oh, nice.
We actually haven't utilized that for a long time. That might still be a functionality. That's option 1. Option 2, obviously, you've got the mobile, and then that will come back into your system. Option 3 is we actually have the ability to
Oh, we lost you.
Did we lose him? Well, while he's trying to get back on, I forgot to mention the mobile capability has an offline capability too. For those that dictate, all they need to do is pick up their mobile device. They'll still see their patient and they can dictate, and it kind of stores it in the cloud until, everything comes back up in the cloud portal. But I think they're going to check on some more options.
Yeah, I was going to say, I think Vince cut out when he was giving us option 3, but that's fine.
I know.
Yeah, I'm not sure what happened with Mr. Vince, so we made note of it, Jamie, and we will find out if some of those I heard the first 2 options he presented, if they're still available. The offline mobile might not be a bad route either. If you're simply dictating into it and then it is going to auto sync when you're back online. We'll get you a couple different options.
Okay. And I assume that capability of using mobile would be also in the surgery center as well.
Absolutely.
Right.
Okay.
Anything else from your end, Jamie?
No, believe it or not.
Is mobile available just for the providers? Is it, because if we are down, how do the nurses and how does the support staff record their information during intake, for instance, if the system is down? Do we have to have separate licenses? How does that work?
Right now, I think there's only provider licenses, but I think you can give access to ancillary staffers. So we'll find out about that. I don't want to say yes or no because I'm not 100% confident. But do you happen to know that, Susan?
Yeah.
Mobile access for non-providers?
Yes. We are getting that is available. Now, I don't know the nuances of it. I do know that we do already have clients doing that, because we have some very large clients that even use it just as messaging back and forth because they're in different buildings, or and they all have phones in their pockets. And so they like to, just communicate back and forth. So they're not, having to go another way that takes them, down a long, lengthy path. So anyway, yes, you can. Now, I don't know if there's any limitations on how many or whatever, but I think that, because we have that free version of mobile where nobody needs dictation necessarily. And then